Hello. Today I'm here to welcome you here to the land of my ancestors and on behalf of the National Rural Health Alliance, and to welcome you to this beautiful country on behalf of all the ancestors and all those who have gone before me and those who are still here and still fighting the cause of having countries that are welcomed to people is one of the main things that we must do as Aboriginal people. Doing this clears the way and makes sure that everybody has a safe and respectful journey through the land of my ancestors. And I welcome you here today on their behalf again, and on behalf of all the future generations that are coming up, and to make sure that we can pave that way for a better way of life for our children. Thank you.
Welcome everyone, wherever you are across Australia, to the National Rural Health Alliance's conversation about affordable and nourishing food during COVID-19 and beyond. My name is Gabriella Cain and I'm the CEO of the National Rural Health Alliance, and I've actually got a background in nutrition and dietetics. Thank you, Matilda, for your very warm welcome to country. And on behalf of the Alliance, I'd like to acknowledge the traditional owners of country here at the Ngunnawal people here in Canberra, and the traditional owners of country throughout Australia. We recognise their continuing connection to lands, waters and communities, and we pay our respects to elders, both past and present, and to Aboriginal cultures. Our vision here at the Alliance is for healthy and sustainable rural, regional and remote communities, and we value equity and inclusion. If we are to achieve better health and wellbeing outcomes for rural communities, then we must address the social determinants of health. A fundamental human right is that all people have access to healthy, affordable and culturally appropriate food. The term food security itself can have different meanings for different people. So if we speak about Australia's capacity to feed its population, then we would say that we were a food secure nation. After all, we do export about 60% of our produce in Australia to overseas markets. However, when we speak about food security of individuals and households and communities, the meaning can take on a very different, meaning. So in these contexts, food security exists when all people at all time have physical and economic access to safe and nutritious foods that meets their dietary needs and food preferences for an active and healthy life. So the definition itself actually points to a more equitable distribution of food within our nation. With employment rates and incomes being lower in rural and remote parts of Australia, then individuals, households and communities in the bush actually are at a greater risk of food insecurity compared to those living in metropolitan areas. Following the recent bushfires and now the COVID-19 pandemic, traditional food supply chains have been severely disrupted, putting rural and remote communities at an even greater risk of food insecurity. So today we're going to examine some of these issues from different perspectives. So we've been joined by 4 people today who are going to give you a different slant on food security for people living rurally and provide some possible solutions to the problem. So each speaker is going to give a brief presentation, and at the end of the presentations there'll be time for questions. So if you haven't already done so and you want to submit a question throughout the presentation, then email to conference@ruralhealth.org.au. So first up today we have Professor Danielle Gallegos to speak to you. So Danielle is the chair of the Woolworths Centre for Child Nutrition, which is funded by the Queensland Children's Hospital Foundation. She has over 30 years experience as a dietitian, with 15 of those as a public health nutritionist and 10 years in academia. So Danielle has built a research profile that emphasises qualitative research methodologies in areas related to social justice and the evaluation of nutrition and physical activity programs. And her main areas of research focuses on household food security and early infant feeding. So Danielle today is going to discuss prevalence rates of household food insecurity, the underlying causes and how these impact on rural communities, and in particular the role of income and income assistance to ensure people can afford to put nutritious food on the table. So welcome, Danielle.
Thanks very much, Gabrielle. So just in the interest of disclosure, I am currently funded by the Children's Hospital Foundation through a philanthropic fund from Woolworths. Woolworths are not involved in the governance of the centre nor in any of the research that we do. You can see that we're undertaking a number of research projects around food insecurity at the moment, one with Pacifica families in Queensland, feeding families in tough times and responsive feeding. I'm currently doing a presentation home, which is part of Turrbal country, and I pay my respect to the peoples and Aboriginal leaders, past, present and emerging. We provided a really nice description of food security, but I just wanted to remind everybody that food security is also a fundamental human right, that everybody has the right to an adequate standard of living, and that includes access to food. So when we're talking about household food insecurity, we're talking, that definition has resonance for for people who are living that experience. The work that we have undertaken food insecurity or food security means for living it, people have said these sorts of things: not feeling sick when you open the fridge and thinking that there's no money to buy more food, not feeling pressured to take that extra shift when you might be sick because you have food in the household, a feeling of confidence that you can have enough money to afford regular meals, that you don't necessarily have to make food stretch by second class or inferior class groceries. So that's the reality of food insecurity for those living it. When we look at the national data, though, the national data uses only one question, and it says that only 4% of Australians are food insecure, of whom 1.5% have gone without food. For Aboriginal and Torres Strait Islander households, in urban areas, that's around 22%, going up to around 31% in remote areas. So based on these figures, we're talking approximately 900,000 Australians are food insecure. However, we think our work that we've done says that those estimates, that one question, underestimates by about 5 to 8 percentage points for the general population. So we're probably talking closer to 12% of the population who is food insecure, which means that's around 2.5 million Australians. But again, work that we've done underestimates food insecurity. Work we've done is indicating that those on low incomes and even those in middle income areas, 1 in 3 households are food insecure. And of those, 1 in 2 adults have limited the variety of the food that they ate, 2 in 5 adults have skipped meals, and 1 in 3 have gone without food to pay other bills. So how do families manage? Well, the first thing that happens for families is that they start to worry about where their next meal is coming from. And that worry is real. It impacts on every part of their lives. In my area, in children, we know that even the worry actually impacts on parenting strategies and the ability of families to be able to parent. The next step is a change in purchasing strategies. Families start to buy in bulk. They might start food that is past their use-by date. They'll look for specials and travel far and wide to get those specials. Then there'll be a change in the amount of food that adults, or the change in the diet quality, which means that families start to eat potentially more calorie-dense, nutrient-poor foods. So, for example, we've got families who've told us that they eat sausages every day because sausages are affordable. They don't need to actually provide any vegetables to go with those, and the kids will eat them beautifully without any argument. The next step is that adults start to skip meals or reduce the size of their meals. And the final step is when children go hungry. The work that we've done, 1 in 20 children have had to go with smaller meals than they normally would. 1 in 12 households are relying on breakfast programs so their children actually get fed before they get to school. So we're talking about some serious impacts on children. So we're thinking 250,000 Australian children are going hungry at least fortnightly. We're not talking about a country over there, we're actually talking in Australia. So there are significant numbers of children that are not getting enough to eat on a regular basis. When you break down household food insecurity, there are 4 elements to that. One of those is access, and when we're talking, I'm going to talk a little bit more about access in a minute. The other is availability, and Gabrielle talked a little bit about availability and the lack of availability in rural and remote areas in particular. We're talking about affordability, and then the other element is utilisation. That's the ability to be able to turn food into meals, that you have the equipment to do that and the skills to be able to do that. So we have a think about access. We're talking about a complex interplay between income, housing affordability, utilities affordability, and food affordability. Inadequate income is at the root of most food insecurity. Housing affordability is inextricably linked with that, as is the affordability of utilities. We're looking at a situation where the cost of water is likely to increase, and the cost of water in rural areas is likely to increase, and this will have an impact on food security as well. So in rural areas, what we know is that unemployment rates are set to rise. Remote are disproportionately affected by those unemployment rates. During COVID, we've had an increase in job seeker and other welfare payments, which has transformed people's lives, and we need to make this permanent. And renters are at higher risk of poverty and food insecurity, and we need construction of more social housing. We can't overlook that the difference income makes. The recent COVID report from ACOS, which looked at the experiences of about 950 people, showed that small increase in the job seeker payment and the youth allowance to bring it up to just above the poverty line meant that the number of people skipping meals decreased by to 33%, by about half. People's ability to purchase nutritious food dramatically increased, with 93% reporting that they could afford more fresh fruit and vegetables. 83% reported that they were eating better, and a significant number of people also indicated that they're able to now save for major appliances, things like fridges and freezers. What we have in here is a disparity in food pricing. Remote areas typically pay 60% more for their food than other areas in Australia. The Queensland Healthy Food Basket demonstrated over a number of occasions that healthy food prices increase the further you get away from the cities. Sadly, though, we don't have routine food price monitoring or surveillance, and so we're unaware of those fluctuations in prices and how they impact on families. The other silent, and I've put there relatively silent, contributors to food insecurity are the triple whammy effect of mental health, racism, and personal violence. Those three things are known to contribute to food insecurity quite extensively, and are often not talked about in Australia within those parameters. So, what do we need to be advocating for? I've divided, all of us are responsible for doing some advocacy, and I've divided these up in a number of different forms. So, with some structural changes, adequate income, we need to be debating a different system, whether that's universal basic income, whatever that might be, but we need adequate income for all Australians. We need to be talking about a national poverty alleviation strategy. For rural and remote Australia in particular, we can't do anything unless we have climate change mitigation strategies to ensure food availability, and we need monitoring and surveillance. Australia does not collect data on food insecurity on a regular basis. It's very ad hoc. We use a question which underestimates. When we're looking at some economic solutions, we need to be thinking about strengthening the welfare safety net, keeping income above the poverty line. We need to be looking at housing affordability, energy affordability, water affordability, and food affordability. Recently, there were calls that GST should be extended. We need to maintain food as GST-free and potentially extend the subsidy. Research is indicating that going beyond 10% will actually encourage healthy food purchasing. We need some social solutions. We need comprehensive, in-time, in-place mental health prevention management, which in particular in rural areas is overlooked. We need a recognition of racism as a determinant of health and a comprehensive anti-racism strategy from womb to tomb. We need to continue to support domestic violence prevention strategies. And finally, we need some functional solutions. So we need to build food literacy skills, bring it back into the school curriculum. We need to be talking about universal school meals. We need to be having a look at time and reprioritising and the conceptualisation of time, and ensuring that all housing, regardless of where you live, has adequate equipment for you to actually prepare and store food. So these are all the big solutions that we need to be looking at a much broad level. But obviously, we also need, for those people in need, is a food safety net that's sustainable, stigma-free, nutritious, and equitable means that it's available regardless of where you live. If you live in the city, some of those food safety nets are relatively available. If you live in some of the regional and remote areas, perhaps less so. So thank you for listening to that very brief overview of food insecurity, and that's probably a nice segue into the next speaker, and I'm looking forward to the conversation.
Thanks so much, Danielle. Look, you've highlighted some fantastic things in such a brief period. So things like even just the way in which we measure food insecurity. So we're quite possibly looking at a much higher rate than our 4% that our one question asks. So that's a really important thing for people to be understanding today. But I think also just mentioning things like, the issues around mental health, racism, family violence, and that those are sort of partly fundamental to some of the causes of food insecurity. So thank you very much for some really interesting highlights about the issue from your perspective. I think the job seeker payments as well is really critical to our discussions today as well. So thank you. So now I'd like to welcome our second speaker today, who's Ronnie Cain. And Ronnie is probably very well known to many of you as the very colourful and dynamic CEO of OzHarvest. So she's going to discuss the role that OzHarvest plays in reducing hunger and how it provides food relief to people in rural and remote Australia via their mobile markets. Ronnie also has a passion for reducing food waste and improving food literacy through their educational programs, and so she'll be able to speak about some of those initiatives as well. So welcome, Ronnie.
Thank you so very much, and thank you, Danielle, and thank you, team. And I too would like to acknowledge that we meet on the land of our Indigenous people and pay my deep respects. I here am on the Gadigal land of the Eora Nation. And so wherever you are, I pay my deep respects. Fascinating. So just some of the facts, Danielle, that you brought out were really interesting. We have known and have been talking about 5 million Australians that need food relief during the year. So those numbers, when you were talking about the 900,000, I'm thinking, I wish, which world are we living in? Because the reality that we see is the need is so much higher. And I can tell you that was pre-COVID. And in some instances, just in terms of, we've had at least a 45% uplift in demand from charitable organizations over the last 3 months, as well as a huge demand on food. And I can give you those percentages, but we are looking at another at least 500,000 people coming into that cohort. So we really are not talking about a very low percentage of our population. This is here in Australia. This is so shocking. And this whole notion of rural and regional Australians and the size of our country and the challenge that it takes to, to access that. So let me just share with you just a few facts and figures. Annually, we collect around 10 million kilos of food. We've collected that in the last 3 months. And our model has always been rescuing surplus food, never out-of-date food, perfectly good food, from fresh vegetables to ready-made foods. And so what changed through COVID was the demand became so high and the availability of food so much less that for the first time in 16 years, OzHarvest has purchased food to supplement the rescued food that we deliver, which has enabled us to also roll out a whole lot of new programs. So I wanted to share this notion of our mobile markets. So OzHarvest has always delivered wherever it delivers, and how it delivers is free food to anyone who's in need, and we have done that traditionally through the charitable organizations we support, between 1,300 and 1,600 charities across Australia, mainly in urban Australia, with models that have gone into regional through a volunteer system. Last year, we trialed a new technology, and I do believe that new technology has function in perhaps working within regional Australia. And that is an app that connects good food with people in need. And we always say that technology needs a heart, that just to go out, for example, to take, let's say, a store like Woolworths and say, whether it's in Arnhem Land or wherever it is, and we identify someone who needs food, without the connector and without someone monitoring that falls through very often. That's what our experience has been. So our model with technology in reaching remote or regional areas is to find the need, to find a source of food, to connect those, and to try and make sure that that lasts. That's just one way. During COVID, we identified that regional Australia needed more food and that we needed more food available across a much broader area than just our charities, because many of our charities closed. So we created 2 new programs, and the one is the hamper hubs or food box hubs, where we've been handing out directly to individuals, whether they be international students or visa holders who have no support, or in regional areas, beautiful quality, and it's all based on quality, and it's all based on healthy, nutritious food. Our boxes are not filled with either leftovers or it's very much balanced based on our education programs. And within every one of those boxes, there's meal planner, there's menus. So we put in things like lentils and produce that can be used to provide healthy meals. Our mobile markets have been on the road, and so far that's only in New South Wales, but we're looking to roll that out in other states. But again, this all depends on funding, where we fill up the vehicle with fresh fruit, fresh vegetables, and dry goods, and drive into regional areas. We've been working very closely with the CWA to identify areas that we could reach and to identify people where we come in and provide food for free. And the intention is to go on a rotating program and provide as much produce as possible. So I guess for me, the frustration has always been, what are the long-term solutions? I never wanted to create a Band-Aid. What I wanted to create was equitable food distribution to anyone who needs it, and to minimize those that need it, and to upskill those that do need it, so that they also understand the value of how to purchase well. So our school programs, we have two. Our feast program is very much about teaching kids the lessons of both sustainability, nutrition, how to prepare very good quality, beautiful food at very low prices, teaching kids, teaching teachers, because as Danielle mentioned, the school system is failing us because there are no programs that cover off on what we used to call home economics, or how to cook and how to prepare food nutritiously and healthily. So we have a program that is currently being offered for free to schools across the country. It's curriculum ready. It's part of the STEM system. It teaches teachers, and we turned it digital over COVID. So we can go direct to families, and we've taught more teachers how to deliver this program. So if anyone wants to find out more about that, please come to, probably best not to come to me, go education@OzHarvest or info@ozharvest.org regarding education. But that program can go into schools. We got funded to deliver that program for free, and I think we've still got at least 100 schools we could give that to, or families is online. And that's also using material from our NEST program, which is all about teaching either vulnerable people, but it could be any of us, how to cook sustainable, healthy food on an average of $2 to $3 using beautiful proteins like lentils, beans, etc. And that program informed all of our food boxes and the hampers that we've been delivering around the country. So I want to reinforce that there are 5 million Australians that at some point in a year require food relief. Many more, it's ongoing. Our school programs show us that every single school, even if it's in what is considered a good area, there are kids coming to school without food, without breakfast. So we have school programs. And the whole notion for us is one about both sustainable preparation of food, sustainable notion of teaching people how to look after themselves in a healthy and nutritious way. And that's all been amplified through COVID. And from our mobile market to our hampers to our cooked meals, we've delivered. We're delivering over 15,000 ready prepared meals so far across the country, but again, in some rural spots and regional spots, but not too far reaching. We're looking for collaborations for that. So we'd love to talk to anybody who would like us to access or to help us through them access either any of our programs. So I'm not sure how long I've spoken for, but I'm happy to give more information, but can wait till Q&A.
Look, thank you very much, Ronnie, for some of the insights into some of the new work that you're doing for rural areas and more remote areas. So those hamper hubs sound like a great idea that you're currently doing in New South Wales, and hopefully that goes a bit further than New South Wales and to more nationally.
Sorry, just to elaborate, we are doing those also in Victoria, South Australia. So that's with the intention of doing more, depending on funding.
Oh, look, that sounds fantastic. And I think also you're building in the use of technology to try and link people that need food relief. So those sort of initiatives sound fantastic. And we're very pleased that you've got CWA involved, because they're one of our member organisations. So that's fantastic. Very good. Yeah. So now we're going to move on to our third speaker for today, and that's Ms. Kaya De Silva, who's the Nutrition Manager at the Arnhem Land Progress Aboriginal Corporation, or ALPA, where she supports the implementation of the ALPA Health and Nutrition Strategy across 25 remote community stores in the Northern Territory and Northern Queensland. The strategy aims to improve the availability and affordability of health foods and drinks, and supports customers to make healthier choices through modified merchandising practices and in-store educational programs. So today, Kaya will discuss the impact of COVID-19 on the remote store food supply and the consequences for affordability. She's also going to outline some of the outcomes of the research project that was co-designed by ALPA, but also Monash University and the Menzies School of Health Research. So welcome, Kaya.
Thank you. Mine gets me through. Thank you for the share a bit of ALPA's journey to improve access to affordable and nourishing foods. I'm just going to turn on camera so that everyone can hear me. So, as a non-for-profit organisation, our journey started in 1972, and since that time, we've grown to be the largest Aboriginal corporation in Australia, operating 25 remote community stores across Northern Territory and Queensland, as well as being leading service providers, community service programs, and owning successful enterprise businesses that are joint ventures with local families to support ongoing employment and career opportunities. Our strong leadership comes from our all-Yolngu Board of Directors, who are pictured on my slide in their red ALPA shirts, and they represent our 5 member communities of Gulawinku, Gapuyak, Milingimbi, Minjalang and Ramingining. You'll see a map of our store locations. So the yellow dots represent our 7 member stores in East Arnhem Land. The blue dots represent our 6 stores in Cape York and Torres Strait, which operate under Island and Cape Enterprises. And the white dots represent the 12 stores we manage on behalf of other Aboriginal organisations and local councils. All of the stores we operate are viable social enterprises with an emphasis on local employment, training and nutrition. The surpluses that are generated from our stores are reinvested back into the community with programs such as health, education and cultural activities, which are important investments for our local store boards. Additionally, the surpluses are reinvested back into improving retail services to promote ongoing food security. So nutrition has been a cornerstone of ALPA since we started, with the first ALPA health and nutrition policy being developed in the 1980s. Our strategy has 4 key objectives: improving affordability and availability of healthy options, as well as supporting customers to make healthy food choices through merchandising strategies and increasing the awareness and understanding of health and nutrition of our customers. So today I'll be focusing on what we're doing in terms of improving affordability and supporting customers to make healthy food choices. So this is just a brief snapshot at some of the strategies we employ, but I recommend keeping an eye out for our submission into the latest remote stores inquiry. So firstly, central pricing. So our merchandise team negotiate prices for all of our stores, utilising our combined stock volume to secure better prices and promotional deals from our preferred supplier, prioritising our healthy lines and essential goods. In the retail world, volume drives price. So in comparison to other independently or privately run remote stores, we turn over a larger volume of stock, which allows us to obtain cheaper prices from our suppliers. Freight subsidy. So ALPA have self-funded a freight subsidy on fresh, frozen and canned vegetables, as well as some fresh dairy lines since the 1980s, and that's completely independent of government funding. So it's equivalent to, in our last financial year, $250,000, so a very big investment, supporting the affordability of healthy options. Finally, preferential pricing. So we implement preferential pricing to make our healthy options more affordable than our unhealthy options to support increased consumption. So an example of that is our drink pricing strategy, with water being the cheapest available drink at $1 for a 600ml bottle. And then our no sugar varieties are at least 20% cheaper than the full sugar equivalents. So we use this preferential pricing structure in other commodities across our stores to support customers to move across to the healthy options in our stores. Despite implementing our strategies, we are aware that there's still a significant price gap that exists in urban and remote communities. I guess the first thing is, if we look at the broad Australian retail sector, our business is equivalent to two Coles or Woolworths supermarkets. So we don't have the buying power or the bargaining that the supermarket giants have with manufacturers, which means we can't buy products at the same cost as they can, and we can't sell products at the same cost as they can without impacting store availability. It's essential that stores operate with sound financial practices, so continuing to be viable. If that store closes down because they are no longer viable, then it has a massive impact on food security for that community, with families having to travel large distances to the next available supermarket. So it's the same story for freight. Because of their size, the supermarket giants are able to negotiate cheaper freight costs and have been able to introduce national freight schemes, meaning that their city stores absorb the increased freight costs of their rural and remote stores. We're not able to introduce a standard freight because of our business structure and our retail size. So each of our stores have their own freight rates. And for our island stores who rely on sea transport, or our stores who have to fly stock in for up to 6 months a year because they're cut off from the wet season rains, their freight rates are particularly high, and there's no government support to subsidise these in this instance. Finally, the cost of doing business in the bush is higher. And I think that high operational costs exist for all the service providers in remote communities. So emergency services, schools, councils. I guess the difference between those services and remote stores is that they're government funded, so they can offset those high operational costs. But we have significantly high costs in employment, insurance, governance, power, rent, repairs and maintenance. And there are no subsidies to offset these high operational costs. I guess if it was easy to do, and if the supermarket giants thought they could make a lot of money in remote communities, they'd be in remote communities, and there's a reason they're not there. It's a hard job. To really address the price disparity that exists in remote communities, we need intersectoral support from manufacturers, government, suppliers, the major retail chains, remote store retailers, land councils and traditional owners to really start to come up with long-term solutions. And COVID-19 has had any silver lining. It has got the ball rolling through the National Food Security Working Group, which ALPA are a part of. So enter COVID-19, and we're all aware of what our supermarkets look like, and this put a significant strain on the food supply across the country. And we were really fortunate to have strong leadership through our CEO, who was advocating for improvements in getting ring-fencing stock for remotes, not just our stores. We had a great merchandise team who were able to work with all of our stores and suppliers to make sure that we had all of our essentials on display. slide. So the factors leading that impacting remote food supply because of COVID-19. Firstly, the Prime Minister's decision to allow the major retailers to join forces to get products on their shelves came at the consequence of our smaller businesses, particularly remote, without prioritising the stock from Woolworths. Suppliers really struggled to get their hands stock. Once stock levels dwindled from our unpreferred suppliers, we had to look everywhere and anywhere for stock to ensure that food security was maintained. This means that we're seeing stock outside of our trading terms, so at a higher cost. ALPA as a business decided to absorb that increased cost, so it wasn't passed on to our customers. Long that's not a viable option, so we really had to have that supply re-ended. Would have noticed a different product in our communities where manufacturers were prioritising the high volume lines of Coles and Woolworths, which are not necessarily the high volume lines. And big challenges was getting access to our generic low cost options because the manufacturers just weren't producing them. So our customers were having higher also smaller pack sizes. So an example of this is we couldn't get our hands on rice. We had supply challenges. With COVID-19 came the introduction of security zones to minimise COVID-19 spread, and remote were encouraged and supported to return to communities. We had 30% more. The introduction of the stimulus package and increase to the New Start allowance, customers had more spend and they had more two stores, so there was a significant in our demand. The last factor that was impacting our access was the permit systems to gain entry by security areas. Our transport company struggling at times to get the right paperwork in place because it came in the top end. And so we worked until the 11th hour to get the right permits to make sure that we didn't miss a single delivery. But we came close a few times, and I can imagine there were other sort of delays in delivery. I guess why COVID is shone a spotlight on affordability, it's also shone a spotlight on the disparity that exists in remote communities. We had to implement the biosecurity areas of the increased risk with higher rates of chronic diseases and obviously significant overcrowding due to the housing crisis. So while we need to look for solutions to improve affordability, we also need solutions to support customers to make healthy food choices, which are available in remote communities, without taking their choice away. So one way ALPA are doing that is through Healthy Stores 2020, where we co-designed this randomised control trial with Monash University, Menzies School of Health Research and others out of a response from community leaders who wanted to put strategies in place to curb sugar consumption. So this strategy is looking at making our healthy options more visible and our unhealthy options less visible and desirable to our customers. So I'm going to play a quick 1-minute video which will just summarise those strategies.
We're targeting the 4 highest contributors to sugar in customers' diet, so that being sugary drinks, sweet biscuits, confectionery and table sugar.
We've seen a lot of young people, sugar was really high, so I thought it was a good idea to introduce, and the board was happy doing that.
We haven't reduced the amount of products available to the customer, but the shelf space allocated to those products has been reduced. We're also targeting high traffic areas, the front counter, front of store. We've actually removed 1.25 litre full sugar drinks from the refrigerators, so it's only available on the shelf.
But we also really want to have a big emphasis on promoting the healthy options that are available. The leaders of our communities have decided that they need to make a change, and it starts at the store where the food is available.
Next slide. So our pub currently under review, and so the preliminary results are really successful. We were able to support a reduction in free sugars from confectionery by 9.5%, reduce free sugars from soft drink by 12.5%, and overall we had a 2.8% reduction in free sugars over 12 weeks in 10 stores. So when you look at that in terms of volume of sugar, that's 1.8 less tonnes of sugar going into communities in just a short period of time. So if we look at it for over 12 months, that's almost eight tonnes. And if we can roll this initiative out to other stores, it's going to have a significant impact on improving health outcomes. And we need to look at solutions like implementing these strategies in licensing or benchmarking schemes, or potentially through land lease agreements to support the health of customers. And ALPA and our consultancy store boards are committed to Healthy Stores 2020 and have rolled this out across the board, which is amazing, and they should be congratulated. So thank you very much for this opportunity.
Well, thank you very much, Kaya. That was fantastic. And I'm sorry we didn't see your face in that presentation. And we still did have a few little disruptions to the presentation, but look, thank you so much. I'm really interested in the freight subsidy work that's been done, and where we really need to be going to government in order to, sort of implement the freight subsidy, rather than having to, to expect other organisations and, private enterprise to necessarily do that. So I think the intersectoral kind of approach seems like a really good one, but I think we need to work really hard on that. So that's fantastic. But all the work that you're doing in relation to, making food more available that's healthier and more affordable, fantastic initiatives. So what a fantastic social enterprise that you've got going up there. So thanks again. Now I'd actually like to introduce to you our fourth speaker for today. This is Dr. Josie Douglass, and Josie leads the Central Land Council's Advocacy and Research Program in Alice Springs across policy areas that range from land rights to remote housing and education to constitutional reform and treaty. So Josie has worked in community-controlled organisations and held senior research positions at the CSIRO and the Charles Darwin University. Josie is descended from the Waterman people, whose traditional lands lie to the southwest of Katherine in the Northern Territory, and she's lived and worked on lands of the Arrente people in Alice Springs since 1991. So Josie today will discuss her policy work in helping to drive systemic change to improve food security for those living in rural and remote communities. So thank you very much, Josie.
Thank you for that introduction, and I too would also like to acknowledge that I am on the lands of the Arrende people, gorgeous country in Alice Springs and Central Australia, and also acknowledge the lands that the speakers have all presented from this afternoon. So I work at the Central Land Council, and we are in the southern half of the Northern Territory. As you can see, we cover quite a large area of land. We have a diverse community, 15 major language groups. 50% of the land in the southern region is Aboriginal owned land under the Aboriginal Land Rights Act. Sorry, just go to the previous slide. Right. Sorry. Oh, sorry, I'm having some fun with the slides here. There we go. So the Central Land Council, we are governed by 90 Aboriginal people elected. We normally get the Australian Electoral Commission in, or the Northern Territory Electoral Commission in, to carry out the voting process, and our council provides the governance of the CLC. We're an independent statutory body, so we operate under the Commonwealth Aboriginal Land Rights Act as well as the Native Title Act, and under the Northern Territory Pastoral Lands Act. So during the COVID pandemic, certainly did magnify the issues around food insecurity for remote communities and outstations in the southern Northern Territory. The narrative of government changed as well. For many years, Aboriginal people and certainly the public policy response was that you need to move into regional centres and towns for employment opportunities, for education. However, during the pandemic, people were being told you are safest on country, and the Central Land Council agreed, and you're safest on your outstations. So people, and then we had the biosecurity restrictions brought in, so people could not leave their community or outstation to travel into urban centres like Alice Springs or Tennant Creek or Katherine or Darwin. So they relied during the biosecurity restrictions totally on their local community store. What it also showed was the failure of government policy over many decades and neglect and investment in infrastructure on remote communities. So people in remote communities were very fearful of the pandemic, particularly because Aboriginal people have such a high level of existing health concerns. So there was a lot of concern from people in remote communities, and Aboriginal leadership and organisations were also calling for borders to be closed. But what it meant was that the travel restrictions meant that community-owned stores in remote regions had to meet 100% of people's needs and across a greater range of products. And so stores had to greatly increase their orders, but the stores in Central Australia are the smaller independent Aboriginal community-owned stores. So they had problems with enough storage and refrigeration and freezer space for the increase in the orders. Independent suppliers struggled to get what they needed for remote stores. We all know that the prices in remote community stores has been a major issue for many, many years. And this is borne out in every anti-government market basket survey. So as was alluded to, as was stated, I should say in an earlier presentation, food is 60% higher on remote communities than at major supermarkets. So food security impacts on all aspects of life, from housing to education to health. Adding to the complexity of food security is the geographical isolation of many of our remote communities in Central Australia and indeed the Northern Territory. Remote stores face many challenges, including the high costs of transport that's been touched on, the poor conditions of roads in long distances, the high overheads, including the capital required to build and maintain and upgrade store infrastructure, high staff wages and greater wastage of food stock, some of which is related to the short shelf life that food has once it's arrived in remote stores. The Central Land Council, along with a number of other organisations who we are in alliance with, Aboriginal peak organisations of the Northern Territory, advocated really strongly around food security during the pandemic. And we were quite pleased that Minister Wyatt announced the inquiry into food pricing and food security in remote Indigenous communities. However, this is the latest in a long line of government inquiries, plans and policies that aim to address food security. And so even though we welcome it, there has been a number of inquiries done over the years with still not much action. So what is needed from the CLC perspective? Three things I just want to touch on now is that governments need to acknowledge that remote community stores are not just a local business, but a critical social service on which the community relies. And remote stores are a critical component of the complex mix of social determinants of health for all people living in remote communities. Also that the government, the Australian government, needs to give serious consideration to reducing the impediments to accessing affordable food and other essential goods through the support to all remote stores by subsidising high operating costs and regulating retail pricing to ensure all remote stores have long-term viability. We would also like to see the current increase in welfare payments retained, and also to implement an increase in indexation of the remote area allowance for welfare recipients for both remote and very remote areas to reflect the higher cost of living in these areas compared to the rest of Australia. In summary, Central Australia has smaller communities and a greater number of independent community stores, and these stores have greater challenges to maintaining viability due to less buying power than larger retail groups, lower turnover due to community size, and less access to government support due to limited staffing and distance from power and the ability to advocate for funding. There is a greater need to support these smaller independent community stores as they are primarily owned by local Aboriginal organisations that invest back into community. So simple measures like local service providers and visiting organisations purchasing food from stores instead of major towns for their programs could have a major impact on stores. So purchasing food for the old people's program or their women's program, for example, would make a huge difference. There does need to be greater investment in housing to reduce overcrowding and to invest in housing hardware infrastructure like functioning ovens, taps, fridges and food preparation areas to allow people to purchase, safely store and cook healthy food. Without this, people have little option but to eat expensive, unhealthy takeaway food. Just like to make a point that emergency food relief is not the solution to remote community food insecurity, as it only further distorts the market and it builds on a handout dependence and disempowers communities. Its role is to support through crisis, through floods, cyclones or social crisis. And finally, just to reinforce that those on social security payments, the majority of Aboriginal people in remote communities need sufficient funds to afford the basics. Food on average, again, is 60% more expensive in remote communities and can require over 150% of the average household income in remote communities, yet a couple only receives an extra $15.60 a fortnight than someone living in Sydney. Everything costs more on remote, from your fuel to your food to your telecommunications. It's just all so much more expensive. And the COVID-19 pandemic has certainly magnified issues of food security on remote communities, but on the price of living generally in remote communities is so much higher. So on that note, I'll finish there, and thank you for listening.
Thank you so much, Josie. I think what you've spoken about just now has sort of brought together what everybody has been saying across the 4 different presentations today, which is great, because the sort of things that you're talking about in terms of long-term solution, it has to be around empowering people, you know, to be able to, you know, make the selection of healthy choices that they want to make. But to allow that to happen, then there has to be sufficient income for people. So things like the JobKeeper payment is going to be part of that. Sorry, the job seeker payment is going to be very much part of all of that. So looking at that whole notion of welfare payments is really critical. The idea around the remote area allowance sounds like a fabulous kind of idea, but also you tapped into that notion about the subsidies, and so looking at, going back to Kaya's presentation around freight subsidies, but there needs to be considerably more in the way of subsidies for some of these remote areas. So that was really important to support some of those independent stores. And also some of the other ideas around purchasing, you know, for the women's programs and the elderly programs and things like that. But also tapping into some of those other social determinants of health around housing and making sure that houses are well equipped with, you know, functioning ovens and fridges, etc. So thank you very much. You've really pulled so much of what's been talked about today together. So that's fantastic. So thank you to all of you for some really interesting insights. Look, Ronnie has to go now, so she's saying farewell. She has to go off to another meeting. So thank you very much for your contribution today.
Thank you, but so fascinating, and I'd love to work with all of you to see how we can support in any way getting more food into your areas. So let's stay connected. Thanks.
Fantastic.
Thanks,
Thank you, Ronnie. A pleasure. So we now have, we've got some questions at the moment, so I'm going to ask all of the panellists. I might just sort of nominate your opportunity, but if I was asking you what is the one thing that will really make the biggest difference to addressing medium to long-term food insecurity for individuals and households in rural and remote communities, what would you say? So could I go to perhaps Danielle first?
Sure. The one big difference, I think, would be increasing income. So I think we need to be looking at the welfare payments. We need to be creating employment opportunities and generating livelihood strategies in regional and remote Australia. You know, on the news the other day, there was a bit of a concerning statement made that, you know, we need to keep job seeker below minimum wage to encourage people to go to work. Well, that's fine if there's work available and employment opportunities to actually access. So I think that, you know, making sure those payments are in line with, you know, a living wage so that people are not anxious about where their next meal is coming from. And in line with that, then you can increase income, but, you know, if everything is more expensive in remote areas, then, you know, increasing that remote allowance and ensuring food equity is going to be essential.
Fantastic. Thank you very much, Danielle. Kaya, have you got an answer to that question? What are your thoughts on that?
Yeah, we see the biggest strategy is getting everyone on the same table to find solutions that are going to create real change in a supportive environment. So, you know, getting prices down. In terms of from our board perspective, increasing welfare allowance could increase welfare dependency, and our board members see that as disempowering their communities. So we want to be looking for, you know, changes that are going to reduce the prices of foods in remote communities.
Yep. Thank you, Kaya. And Josie, can I go to you?
Sure, it's a very good question. So first of all, I think that we do need to increase social security payments to people. That's made a huge difference during the pandemic in terms of people were able to buy. There was an increase that we heard from remote stores in our region in vegetables and meat and fresh food. So people had more income to buy more quality, nutritious food. So I certainly agree that we need to increase social security payments to people. The second point I would like to make is this, and it's something that the Central Land Council feels really strongly about. In terms of social security benefits, when that's delivered, the delivery of that to people in remote and very remote regions is called the Community Development Program, or it used to be called the CDEP program. If you want to transform remote communities, we need a reformed CDP program, and it's where you work for the dole, as it's colloquially known, and there's obligations that you have to do each day to receive your welfare. However, it's not about creating jobs. So the CLC, with a range of other organisations, have come up with a better CDP program where it's about creating jobs. There are no jobs on remote communities. So the Commonwealth Government, the Australian Government, must give up on trying to force people into to managing people's behaviour to move them from welfare into jobs when there just are no jobs. So a better CDP program will enable Aboriginal community-controlled organisations to identify the jobs that need to be done. We've also included a very important category for our young people. We know young people across Australia are suffering under the COVID pandemic. However, it's certainly the case for young Aboriginal people who will never, the risk is this, they will never have the opportunity to experience work. So if you want to increase employment, reduce joblessness, and also get people out of the poverty trap which they're stuck in terms of social security, reform CDP, and we have a solution to that. And we would very much like to sit down and talk to government about how they can do that. It will transform the landscape of remote Australia.
Oh, fantastic. Thank you. I've got another question here. So what has been your experience of the importance of food literacy in people being able to provide their household with nutritious and affordable food? Kaya, are you there?
Yeah, sorry, I've just had to turn my camera off, so hopefully everyone can hear me. Prior to starting with ARPA, I was a remote nutritionist dietitian for 7 years, and there are definitely gaps in health literacy, but it's really challenging for people to make, grow their knowledge and try and implement those recommendations that are provided if there isn't a supportive environment to help them make that change. So, while health literacy and food literacy is important, we need real investment in a workforce that's there to support stores to make improvements. And currently, the workforce that exists has to split their time between clinic and public health. And so the attention isn't on improving store environments, which are going to have bigger impacts on supporting healthy food purchases and obviously healthy food consumption. And in some states that we operate in, like Queensland, there is no public health nutrition workforce to work with our competitors. So it's really challenging for us to implement all of our nutrition policies when we've got competitors who aren't doing the same thing. So yes, food literacy is important, but we first need to focus on improving the food environment that exists in remote communities.
Yeah, thank you, Kaya. What about Danielle? What are your thoughts?
Look, Gabriella, this is I'm often asked about food literacy programs and food security, and I think that we've got to remember that many severely food insecure families are already very food literate. Stretched as far as it will go. They've changed their purchasing strategies. They're doing a lot already that could be described as food literacy. And you can't, if there's no food and you can't put food on the table, it doesn't matter how much food literacy you have. If you don't have the equipment or the utensils, it really doesn't matter how much, food literacy you have. So we say that food literacy can extend the time that you're food secure, but it cannot alleviate food insecurity in and of itself. Having said that, though, we do have, we've lost food skills in schools. And we need to make sure not only those who are experiencing food insecurity, but everybody builds their food literacy. So that, regardless of the circumstances, you have some control over your diet and some resilience in your diet.
Danielle, can I just add to that? Just when you were talking earlier about, you mentioned time and rethinking time and perhaps the way we use time. Do you want to add anything about that just now?
I think we underestimate the impact of time. Often when we were talking about people living with poverty, the throwaway comment is, oh, they've got plenty of time. They can, cook from scratch, it's not going to be a problem. And yet the families we talk to, they're on the phones trying to rearrange bills, they're, at the school helping with the kids, they're doing a whole lot of stuff and the time's not necessarily there. So we have to be careful about making judgments about time. If you're living in poverty and you might have an unreliable car, you might have to be relying on, unreliable childcare, all of that takes time. So I think that it's about looking at the time equation and thinking through how we can actually, make meals and food quick to prepare, but also, and not actually make those judgment calls.
Yeah, fantastic. Thank you. Josie, what are your thoughts about that question about food literacy and its importance?
I think food literacy is very important. We have a lot of young parents, we have a lot of children who are being diagnosed with very early age diabetes because of their diets. We have a lot of older people who have a range of health conditions. We also have children with who are low in iron, for example. So there's a whole lot, across the generations within Aboriginal families, from the young to the old, really need a greater awareness of, I think, food labelling and food literacy, to be able to read the sugar content. And I know there's been a lot of work done in this area, but I think there needs to be a more concerted effort. I agree with the comments that have been made. We do need to have ensure that the healthy food options are more visible and easily available. We've also been calling out CLC for a subsidy on healthy food items, so say 100 items, leaving out, of course, the sweet drinks and the confectionaries to make food more affordable to people. But certainly food literacy is crucially important in terms of the health of the Aboriginal population, and for young parents to be able to look after and care for children and to understand food labelling, I think is certainly a big issue.
Thank you very
Gabrielle,
much.
can I just add something to that? Sure. Because I think Josie raised a good point been raised recently, and that is we're starting to get calls again for a broadening of the base for GST. And at the moment, healthy food items are GST free, and we need to keep them GST free, and in fact perhaps extend it so that there's a 20% subsidy which has been shown to actually impact on purchasing. But if we're starting to talk about broadening the base of GST again, then we all need to make sure that food is not included.
Yeah.
Thank you for those comments, and that's great to reinforce that point. Look, Josie, we are coming close to time here, but there was a mention earlier about appropriate food storage, like refrigeration and hygienic preparation sort of facilities and that sort of thing. So what more could be done to support some of that from your perspective?
Well, for the small independent stores in the Central Australian region, certainly government support. It does come back to government having to put their hand in their pocket and support these small independent stores if they're wanting to upgrade their refrigeration or their freezer capacity, and also for storage. So a lot of the restrictions on the independent stores, from ensuring that they had a 9-week or a 6-week guarantee of stock, and also given that freight had slowed down from interstate, it was very difficult to source a lot of products, and even, you know, for babies as well was a huge concern. That there is an opportunity there for government to provide, you know, an upgrades within refrigeration and freezer and storage. Certainly that's something that government can do. But of course there's also, in terms of the individual household, is ensuring that there's functioning health hardware, that taps work, that the oven works. You know, people live very simply in remote communities. You know, there's not you'd find a kind of average household in Sydney or Melbourne where there's 3 televisions, two fridges, a freezer, computers throughout the house. People live very simply. There's probably one fridge, and you know, so, and you want the oven to be working and the stovetop to be working. So that's making sure that there's functioning health hardware, and investing in that is something that should be done.
Look, fantastic. Look, I'd love to be able to call on some of the other speakers, but we have run out of time for today. But can I assure you that the Alliance is doing work with ACOS around their job seeker payments, and trying to make sure that government doesn't withdraw from that payment, and keeping it at the level that it is at the moment, to ensure that people don't have to go into poverty, and that can help, of course, to address this issue of food insecurity. So can I thank you, all of you today, for your presentations and your contribution to this whole issue of food insecurity during COVID-19 and beyond. And I do want to keep the conversation going so that we can actually work together to see if we can get some solutions into the future. So thank you again. And thanks everyone for joining us across the country.
Thank you.
Thank you.
Thanks.
Talk to them.